And now, a segment from the Best of the Night Side with Barb DiGiulio podcast. Listen and download the latest podcast at Newstalk1010.com.
Welcome back to the show. We have a terrific hour lined up for you. Dr. Stephen Mulholland is back, cosmetic plastic surgeon at SpaMedica. He is one of Canada's leading cosmetic plastic surgeons. He's also a great friend of the Night Side, and we welcome him back. You're so busy, so we really appreciate you being here.
Well, thanks so much for having me, Barb.
What kind of day was it today? Were you in surgery today, or?
Today was a surgical day, a scalpel-based transformation day. Yes. Sometimes it does come to that.
I know one night you showed up in your scrubs, but you've dressed up so nicely for us tonight.
Yes, I felt that you didn't see the other side of the night side of me.
Well, you are here, and we've already got some great questions lined up for you. 416-872-1010 if you have any questions for Dr. Stephen Mulholland. And again, if you would like to be anonymous, you can just go ahead with that. We're comfortable with it. I think a lot of times, and we're going to get to the phones, Dr. Mulholland, I think a lot of times people, as they're getting into their 40s and their 50s, maybe starting to think like, I don't know if I want to go under the knife, but there are so many other options available to them.
It really has changed dramatically. I think last year in North America, there was about $5 billion spent on cosmetic enhancement. Of that now, 90% is non-surgical. So
wow.
With things like Botox and Juvederm and lasers and tighteners, and we have so many ways to keep your face and your body looking good without a scalpel. I think it's been a great, what I would call a democratization, that it's not as expensive as you would think, and that anyone who works hard, saves a little money after kids and family obligations can afford to look a little fresher, a little brighter, a little more youthful if that's important to them.
Are there also financing plans?
There is indeed. There's a company called iFinance Canada or Medicard that will take your goal, your vision, and finance it over terms of 36, 60, 72 months at reasonable rates.
You were telling me right before we go to the phones, you were telling me this, well, and I laughed. I thought it was funny, but there is an actual method to how people age in their face. You started at the top and worked your way down.
It really is. I call it 3D aging: deflation, descent, and degeneration. And of course, Isaac Newton.
So depressing.
And depression, yes. Isaac Newton actually weighs in this quite heavily. Thank goodness we live in a gravitational field or I'd be unemployed. And so Isaac starts at the brow, pulls your brow down, you get a little hooding and a little tiredness around the eyes in your 40s. So many women and increasingly men will look at eyelid non-surgical treatments or surgical treatments. And then in their 50s, it becomes a cheek and a jowly sort of dowdy sort of treatment. And then finally in your 60s, it becomes a neck and you become a waddle. And we do sort of waddle treatments. And so it's very predictable. Upper third, middle third, lower third, 40s, 50s, and 60s.
Interesting. Very interesting. Let's go to the phones. We've got Jennifer on the line. Hi, Jennifer. Welcome to the Night Side.
Hello.
Hello. Go ahead with Dr. Mulholland.
Hi. I was wondering, actually, this is a question for my mother. She was looking actually into non-surgical treatment of under-eye bags. So she was looking for something that probably is a little bit less expensive than surgical, but she has these kind of puffy, dark circles under her eyes.
That's a very common question, Jennifer. How old is your mom?
She's in her late 50s.
Oh, she's young, very young still. So you must be still in high school. And so,
not quite.
Under eye bags, usually there's some bluish discoloration, and we can treat the veins with specific lasers. The bags themselves, sort of like the eyeball's been sitting on a cushion for 58 years, and the cushion's bulging forward, and we camouflage that with soft tissue fillers that can last up to a year. And finally, for the crinkles and the wrinkles and the crepey skin, non-surgical or surgical lasers can provide that sort of total treatment for the lower lid without a single scalpel. So that's one of the areas we do very well with.
Jennifer, does that answer your question?
It does. I was just wondering, too, what about the cost?
Yeah.
Like that?
Well, it's hard to put a cost on looking awesome and youthful, but there is finite costs. And in general, you can start with fillers anywhere from $400 or $500 a syringe to $800, depending on the longevity of the filler. Lasers are often thrown in at the time by well-meaning physicians. And then in terms of the of surgical treatment for a lower lid bleft, let's say you just want to remove the cushion itself, the bag, that usually is anywhere from $2,500 to $3,000. So you can get started for about $500 to $600.
Wow, thank you so much.
All right, Jennifer. Oh, yeah. No, thanks a lot for the call. Yeah, I was just wondering, as you were describing all of the different things, whether or not non-invasive would be that much cheaper than just doing it once and dealing with it.
You know, in general, if you look at the surgical prices for the brow, the face, the neck, or even liposuction or body contouring, the non-surgical treatments are about half the price for about 20 to 25% of the outcome. And some people who are just, they're scalpel adverse, they're afraid of surgery, pain, and the risk, or they just don't believe in invasive treatments to look your best. We have great options, and it's about half the price of the surgical option.
Speaking of surgeries, so there's a big thing that's been happening. I've been hearing about it for a couple of years, this destination surgery. My mom went with some women to Mexico a few years ago, and she came back and said one of the women left the resort, went and got a facelift, came right back. And I've heard of a place in Costa Rica that's very popular. So people are doing this. Why? Because it's a lot less expensive?
It usually becomes a monetary decision. Sometimes there's some group therapy, like the friends your mom were with. But I think it's very, very important that patients realize, number one, they're not just buying a dress or a coat at Holt Renfrew and some, retail outlet down in the Caribbean or in Thailand or, in South America, that there are real risks. The risks include death, heart attack, stroke, bad soft tissue infections. And these do happen. Now, there are some great surgeons in less developed countries, but the cost is less because usually the healthcare systems are less effective. If you run into a complication, it may be one of the worst decisions you've made, and you have to ask yourself at the end of the day, do you want to take a chance on your life in the name of beauty in a third world country? Usually the answer when you reflect upon it is probably not the best decision. You just need to watch an episode of Botched to sometimes appreciate that.
Do you think that because plastic surgery and all different kinds of procedures have become apparently so common that people forget there's a serious risk involved?
I think that's a very important point, Barb, that, we have this blurred distinction. Sometimes like Botox and Juvederm becomes cool touches, laser hair removal. Oh, it's a facelift. And there's this blurred distinction between the non-invasive with very little risk and scalpel-based surgery, where there's real risks and people do actually have complications. And I think, we have a great medical system here in Canada. We have managed care coverage of complications of cosmetic surgery. We have really well-trained surgeons, all certified by both the provincial bodies and federal bodies. And yeah, it may be a little more expensive, but you can't put a price on health.
Absolutely. 416-872-1010. Dr. Stephen Mulholland is here for the hour. He is a cosmetic plastic surgeon at SpaMedica, one of Canada's leading cosmetic plastic surgeons. If you have any questions about some procedure that you are considering doing, or just questions in general, he's here for the hour. Welcome back to the show. We continue on this hour with Dr. Stephen Mulholland, cosmetic plastic surgeon at SpaMedica, and we are talking about all kinds of stuff to do with plastic surgery. You've got the regular scalpel-based surgery, non-invasive procedures. Some questions coming in on the text board, and we welcome your calls at 416-872-1010. Let's start with a question from Carmen, who asks, can anything be done about large veins on a woman's hands?
It's very common, We always look at faces and we get a sense of a subtle impression of age. But of course, when you look off the face onto the décolleté or the chest or the hands, if a patient, woman or man, particularly women, have done facial treatments like stayed out of the sun, sunblock, worn a hat, little Botox, little Juvederm, maybe some photofacials, they can look 10 years younger than their chronological age.
Wow.
Just look at the hand sometimes. Sometimes the hand gives it away because we don't tend to be as obsessive about protecting it from the sun. It tends to get wrinkly and thin quickly. And you could have the hand sort of from Tales of the Crypt and the face that looks 10 years younger. And of course, that's our job as plastic surgeons to advise. Perhaps we want to protect your hand from sun, wear gloves when you're gardening, and then maybe the same kind of plumper we put in your face, you can put in the hand.
Oh, wow.
And that will help hide the veins. So a little Juvederm, Voluma, or Radius in the back of the hands, a little laser treatment for brown spots. And if the veins are very, very big and they don't camouflage with either your own fat that's grafted or Juvederm, we have little radio frequency and laser probes that we can put up the veins and collapse them down.
Wow.
Yeah.
And that would be, to me, okay, I could be wrong, but that would seem like pretty low on the priority scale when it comes to getting stuff done. But I guess some people are very self-conscious about that.
Some people are very self-conscious about their hands, especially if they've aged deleteriously and they look out of keeping with their, their facial architecture.
Sure.
The hands can be quite disturbing. And so, hand surgery and hand rejuvenation is a big topic at plastic surgery meetings.
Well, you were saying something about Mary Tyler Moore, and if you ever saw those reunion shows, she looked, 20 years younger than the rest of her cast. But then from the neck, it's just, the woman looks a certain way, but then you can see, and I've seen women like that, their face looks very young and their chest is like just a different story.
And back then, in the 70s and 80s, which you're giving your age away, that type of show.
Oh, I'm talking about the reunion show.
Oh, yeah, the reunion show, of course.
Come on.
Right after Bob Newhart and the Brady Bunch. We didn't have a lot of stuff back then for the décolleté or the chest or the hands, and now we do. So at least you can keep the visible cutaneous envelope in the same general decade.
Okay. We've got a lot of questions coming in on the text board, and I understand a lot of people don't want to maybe have their voices heard, but give us a call if you want. 416-872-1010. Dr. Stephen Mulholland is here for the hour. Here are some of the questions for you, though, Dr. Mulholland. I am 49 years old, woman, interested in making my neck look more youthful. There we go. That's what we were talking about. What are your suggestions?
Well, I divide neck into non-surgical and surgical. The problems in the neck are often crepey skin, loose skin, that sort of a turkey type of neck, or that Galapagos Island reptilian sort of wrinkles. And then we've got non-surgical treatments, usually radiofrequency devices like the Profound or the Venus Freeze or the Forma or the Matrix. These are all things that your listeners would have heard about, and we can tighten the skin. We can color correct brown discoloration. We can use Botox to lessen the necklace lines. We can even go under the skin and tighten the skin from underneath, remove some fat. And the final analysis, all those non-excisional techniques may be wanting. And a good old-fashioned mini neck lift is often what you'll be looking at perhaps in your 60s. So start with non-invasive, explore the invasive, and I think the neck can look very youthful. I
have to ask you, whenever I think of or hear of someone having any kind of neck work done, like a surgery, I always think that you just sort of cut open the back and pull it all around the back. What is a neck lift? How do you do that?
I didn't know you went to plastic surgery school. That's amazing. That's why we always encourage long hair.
I would get, you can never wear a ponytail again.
Well, one of the secrets of plastic surgery is not that we don't create scars. We just know how to hide them very, very well. And so for necks, we use the back of the ear and inside the ear. And if you've ever been a seamstress, we have to take the dart out on a dress when we're taking away excess, and excess neck tissue needs to be hidden. And so behind the ear, so you can wear your hair up, no one can see it. Inside the ear, so there's not those telltale signs of white scars in front of the ear from the 80s. We're very, very good at hiding unfair advantages through scalpel-based rejuvenation and keeping it. Even a guy who's completely bald can hide a neck lift scar.
Wow. Mm-hmm. Now, did I hear you say earlier that complications from cosmetic surgery can be covered by healthcare?
Yeah, so anytime you get a complication, even if it's something that was not covered by managed care, experimental cancer treatment or experimental treatment for any medical condition, if you get a complication, that is always covered by a managed healthcare plan. We don't discriminate that you did something that wasn't necessarily covered, but when you're actually sick from that, of course it's covered by your Ontario Health Insurance Plan.
Okay, 416-872-1010. Thomas is on the line. Hi, Thomas. Welcome to the show.
Hi. I have a lot of scarring in my eyelids, and I was thinking about blepharoplasty. And I also was wondering if you could use donor skin for circumcision, or would that look cockeyed?
All right, Thomas, thanks a lot. Is that like a real, what are we...
Well, I'm not sure yet why you let Thomas go off half-cocked like that. But,
I don't know. What is going on with Thomas? Okay, I'm going to assume the first part was serious, scarring in your eyelids?
So you can have scarring from traumatic motor vehicle accidents or cancer surgery, particularly for sun damage. And and he's absolutely right. Perhaps the donor site was a bit sketchy, but we do borrow skin from other places and replace it. Usually the foreskin wouldn't be an option. because if you got excited, you'd have a lot of excess skin in your upper lid, and that would be quite the opposite of what you want to achieve. And so we
This
often
is going downhill so fast.
we often use the lower lid skin and remove a little bit of that and replace it to the upper lid skin
So
with
really?
tricky little flaps. And most plastic surgeons cut their teeth in reconstructive surgery. For example, I did head and neck cancer surgery for 7 years.
Okay.
And we learn all kinds of little tricks to hide scars and minimize scars by using tissue from one place and bring it to another. And so he was on the right track.
So that would be considered grafting. Is that what you're
grafting,
doing?
and then flaps would be vascularized tissue that we sort of move in tricky ways from one place to another to give aesthetically pleasing results.
And if you're talking about scarred tissue like the eyelids, do you actually remove that scarred tissue and put in the other piece?
Correct. So you
Amazing.
remove the scarred tissue, select the ideal donor site, color match, texture, and form, and then delicately inset it to try and make it completely inapparent.
Wow. Okay. Lots of questions coming in for you. Is there any validity to the new cold freeze fat reduction therapy?
There absolutely is. Now, it's the one time we Canadians trump the rest of the world. We live in a subthermal environment. What a great idea. We can now freeze our fat and kill it. And so the product that they're talking about is called Cool Sculpting. And Cool Sculpting is a suction-coupled applicator that over about an hour sucks your fat into this little device quite painlessly, turns down the temperature in the fat environment to about 5 degrees, and results in a non-inflammatory, painless death of fat. Now, I'm not advocating that you perhaps hang out in your fridge for an hour because you need oxygen. And so Cool Sculpting has become a very, very popular treatment for the modest to moderate to small removal of excess, like the pot, the love handles, the outer thighs. And we can combine that with ultrasound treatments like ultrashape and radio frequency treatments like Body Effects to have a triple whammy on fat. So we can get some pretty nice, almost liposuction-like results without having to actually remove the fat.
So this is non-surgical at all?
Completely non-surgical.
It's
Yep.
incredible. And is this one of those things where you have to do a number of treatments, or does it happen all at once?
No, the Cool Sculpting program combined with other treatments such as ultrasound and radio frequency energy, you come in for a one session, and over a couple of hours, we can often make a 1 to 2 inch difference in an area. So, if you've got 9 or 10 inches, 15 centimeters of extra fat, you probably need to go to the gym, lose weight, consider liposuction. But if you've got 2 or 3 annoying inches, as many people do, and they love handle their tummy, come in for an hour or two, and we can often get you down 2 dress sizes.
When you say the fat dies, where does it go?
Well, it's a non-inflammatory death. So imagine, let's say you diet, and these fat cells shrink and they're taken away without causing atherosclerosis or coronary artery disease. We do the same thing with these technologies like Cool Sculpting or UltraShape or Body Effects or Venus Freeze, any one of these products that kill fat. Your body is more than able to accommodate the increased triglycerides without causing deleterious effects in your heart or your cardiovascular system. So it's very, very safe. Been around for a while and becoming extremely popular.
Does it just get absorbed, or does it just...
Yeah, so we have these little cells that scavenge the fat cells that are no longer viable, take them to your liver, process them, and recycle them. So we have the ultimate blue box right in our chubby tummies. We can recycle the fat and reuse it.
All right, we're going to take a break. We've got some calls coming in, 416-872-1010, and more on the text board. We will get to all of the questions. Dr. Stephen Mulholland is here for the hour, cosmetic plastic surgeon at SpaMedica. Any questions you have about scalpel-based surgery, non-invasive procedures, he is here for the hour to answer your questions. You're listening to The Night Side.
Loosen the tie. You're listening to The Night Side on In-Depth Radio, Newstalk 1010.
Welcome back to the show. We're so glad you are with us on this Tuesday night. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at SpaMedica. SpaMedica is located where?
Right in Yorkville, 66 Avenue Road, right across from the old Four Seasons.
Oh, from the old Four Seasons. Okay, so very easy to locate. Dr. Stephen Mulholland is with us about every 4 weeks, answering all of your questions about invasive, non-invasive procedures, anything you'd like to know about. He's here to help you out. 416-872-1010. We'll start with PJ. Hi, PJ. Welcome to the show.
Hi, how are you?
Good, thank you.
So my question was, with the cold sculpting that you were just talking about, do patients or individuals have remaining flappy skin that can be seen with, excessive weight loss and stuff?
Oh, that's a good question.
That's very perceptive. And in general, cool sculpting alone, which kills the fat, can run into the same problem as old-fashioned liposuction. You remove the fat and the skin sometimes doesn't look so good. Sometimes it's better to be a little full-bodied and smooth than deflated and wrinkly. So often we will combine, and medical doctors will combine cool sculpting with bulk heating technologies such as radio frequency devices, most popular of which would be Venus Freeze, Excelus, Body Effects. And so you do your cool sculpting, and then right after that, or within a week, you can do your skin tightening and get a double whammy, tight skin and reduced fat. But that's an excellent question.
Does that help you? Oh, you're welcome. Was there a time when people would have to wear that sort of girdle or something, or like bike shorts after lipo?
Yeah, so in this non-surgical lipo world of cool sculpting, Ultra Shape, Body Effects, there are no garments. There is no recovery. You go right back to your activities, even exercise, and exercise helps mobilize the fat that's been injured. In the lipo world, there's really been a transformation in the last 7-8 years. Now, rather than just remove the fat, we go in there with tiny little probes. We heat it with lasers called smart lipo, or radio frequency energy called body tight, or even ultrasound called Ultra Shape, and we liquefy the fat. So we turn your pot into a mango smoothie, and then we remove it, and it's much, much more gentle, and we get great contraction. You still need to wear that corset. It's like a super Spanx, and you wear that for about 3 weeks, and then the next 3 weeks you wear it just during the day. And so if you have a big event and you're getting modern-based sort of liposuction, think about that event, that reunion, going to the Caribbean, that wedding, back it up by 6 weeks, and you'll look great.
Wow.
But you don't look great in that first 2 to 3 weeks.
So if you are melting the fat and removing it that way, and before it would be really sucking out the fat as it was, does it change the appearance of the skin that's left?
Yeah, that's why lipo got a bad reputation in the 90s, because we just weren't that elegant at it, and it was a rather crude technique, and we would leave irregularities, indentations, the skin wouldn't look great. And so we all have visions of Christian Troy and Nip Tuck and the fat flying around the OR, and it's just changed so much, become a much more delicate, refined procedure with beautiful results for the skin. And so if you want the best result, it's usually going to be lipo. But if you want a quick result and you want to get into that, that wedding dress with a couple inches less with no risk or downtime, then things like cool sculpting are a good option for you.
All right. Up next, we've got Ryan. Hi, Ryan. Welcome to the show. You're on with Dr. Mulholland.
Hey, how are you guys?
We're good, thanks.
Perfect. Doctor, when I was 21, I got a filler called BioAlchemid.
Yes.
Along my cheekbone to kind of build up the appearance of the jaw. The issue is that my doctor at the time didn't disclose this to me, that this is a permanent filler, not a temporary one.
Ryan, can I borrow, sorry to interrupt you. Are you on speaker?
I am.
Is there any way you can pick up?
Is this better?
Much better. Thank you.
Perfect. Sorry, were you able to hear what I've said so far?
Yeah, right. BioAlchemid, one of the long-term polyamide gels. Yep.
So he had this done to build up his jawline? Mm-hmm. Okay, go ahead.
And the issue is it's... like I said, it's a permanent filler, and it was advertised as being very easy to take out if things weren't settling as expected. That's not very true. I've had several attempts at trying to take out as much of the filler as possible, except it leaves these small pockets, which then have the adverse effect. Instead of making it look fuller, they make the jaw look bumpy.
Mm-hmm.
So I'm wondering, I've tried Restylane and a couple of other temporary fillers to kind of fill up the jaw again, but what would you recommend? Should I keep trying to take the BioAlchemid out, or is there another filler that you can recommend?
Well, it's a great question. And how young are you, sir?
I'm 30 now. I got this done in 2006, so about 22 years old.
Okay, and so there are a number of products that when we plastic surgeons and dermatologists look back on Health Canada decisions, we wish maybe some of those fillers hadn't been approved in Canada, such as Articol, Dermalive, BioAlchemid, silicone. And the problem with permanent fillers, they can last for a while, but they sometimes almost inevitably run into a long-term problem, an immune reaction, some hardening, some tightening, and infection. And so BioAlchemid is one of those products that's been taken off the market, as well as the other ones I mentioned, but you're left with the sequela of BioAlchemid. So, you live in Toronto?
Ryan, do you live
yes,
in Toronto?
That's right.
Yeah, and so there are a number of good physicians in Toronto that are experienced with bioalchemid. And then once you've had the chance to remove these under local anesthetic with a needle, and then you got to try and build things up. The whole world has moved towards things that tend to be reversible and go away. So Juvederm, Restylane, as you mentioned. The problem is they just don't last that long, so it'll be quite expensive. The longest lasting reversible gel is usually Juvederm Voluma. And many times with individuals who have had trauma or lipoatrophy from protease inhibitor medications, fat grafting is not possible because there's no other fat stores. But fat grafting is a good option. Looking to products that will give you longevity in the order of a year or two. Is an option. And then trying to seek out a couple of physicians with a lot of experience in removing bioalchemid, sometimes even lifting up the skin, removing any lumpiness and redraping that skin, sort of a mini jawline lift, combined with soft tissue fillers may be an option for you, even though you're young. It's not done for lax skin, but more irregularity. So there's a lot of patients out there like you that have fillers from from a decade ago that are no longer available in the Canadian or European markets. I think Health Canada's gotten a lot more stringent on what's approved and what's not. But you'd have to try to live with this and find the right physician to help you.
Is this something you are comfortable working with?
I do. I did a lot of bioalchemid on lipoatrophy patients with HIV back 10 or more years ago. And then rarely in cosmetic type of patients. And so, as have a number of other plastic surgeons in the city. Dr. Dave Ellis is one as well with a lot of experience. And so generally we can get you looking pretty good, getting the visible bioalchemid and Articol and Dermalive out. And then we got to look for other volumizers to smooth it. So I would look to get it out first, get it as smooth as possible, and then look to other options such as your own fat or other fillers.
Perfect. Thank you very much for your help.
All right, Ryan, thank you very much. So you mentioned that this is no longer on the market. Was it a regular type of filler?
Health Canada has undergone a lot of changes in their regulatory approval process, and for the good, over the past 20 years. And permanent fillers, things that last more than a few years, are not reversible, have their risks, and patients just need to be very careful. The face is not permanent. It's in transition, it's deflating, it's falling. And what looked great in your 30s or 40s, high in your cheekbone, ends up in your mid-cheek and eventually your jowl. So a permanent filler is generally not what you want. You want a transitional filler that will last long enough for your face to age somewhat. And then the next time you come back, you need it in somewhere else.
Right. Yeah. So you're not going to have it in the same place all the time. That's a great point. Thomas, we see you on the line. We have to take a quick break for traffic. You are next, I promise. So stick around. 416-872-1010. You can send us a text question at 71010. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at SpaMedica. You're listening to The Night Side.
Get more of The Night Side on Facebook. Search The Night Side.
Welcome back to the show. Dr. Stephen Mulholland is here till the top of the hour. Cosmetic plastic surgeon at SpaMedica. The website is SpaMedica.com. They are located right in Yorkville on Avenue Road. And you can reach Dr. Mulholland here on the Night Side at 416-872-1010. Text us at 71010. Thomas has been waiting very patiently. Thank you, Thomas, and go ahead with your question.
Oh, good evening. Good evening, everyone. Good evening, Dr. Stephen. I have a sebaceous cyst on the back of my neck, about the size of a hazelnut, and I'm looking for a second opinion on its removal. I'm concerned about risks due to infection, post-surgery, and loss of sensation due to possible nerve damage. Is it best done in the cold of winter? What do you think?
I think sebaceous cysts are very frustrating, and for the listeners, these are little glands that make sebum. They get blocked and they get calcified, and over many years they become enlarged, and they can become cosmetically displeasing and unattractive, and they can sometimes get infected and become an abscess. And so, in general, a very carefully planned surgical excision is usually your best option. This can be done usually under local anesthetic by a board-certified plastic surgeon. You're likely to get the best possible scar. And walking around in the summer, with your back of your neck exposed to the sun is not the best time to expose a scar. And so usually you're right. In winter, when it's nasty out and cold and we're all huddled up in our turtlenecks is the best time to, hoping the Leafs win a game, is the best time to have a sebaceous cyst removed.
So if you had one, you would remove it. You would have a plastic surgeon do it, or a general practitioner, or does it matter?
I don't, there's some excellent general practitioners out there, but in general, plastic surgeons spend 13 years in training to give you the best possible scar. And so if it's in a cosmetically displeasing area or visible area, you probably want to seek out the most expertise opportunity to minimize the scar. And some general practitioners may be excellent at that, but in probability, it's going to be a plastic surgeon.
Could it be? Do you think it could be done for under $500 by a plastic surgeon?
Probably not, sir. But you could certainly ask.
Thomas, thanks a lot for the call. And you know what? The other thing, too, it depends on where the scar is. And does it matter to you what the scar looks like? And then it might be worth seeking out someone who is a professional. But
the OHIP does cover pre-malignant lesions in skin cancers, precancers, things that are concerning.
Okay.
For benign fat growths called lipomas, or these sort of sebaceous cysts or benign moles, generally they're cosmetic. And most plastic surgeons in a city like Toronto or any metropolitan area generally will charge $250 to $500 for a mole, unless for second and third moles. When you got to actually excise something like a lipoma or a benign fat growth or a sebaceous cyst, it's likely going to be in that $750 to $1,500 range minimum, because it's going to take about half an hour.
Are those sebaceous cysts hard or soft to the touch?
They're quite hard, and then if you don't want to rupture them when you're removing them, or the sebum can seep into the tissues, as Tom was indicating, and there may be a risk of an infection. The risk of nerve damage is very, very small, localized sort of numbness over the area of the scar, and rarely does it cause long-term pain. So I think you need to carefully consider, does it bother you? If you have a lesion, a mole, is it cancerous or not? If it's not cancerous, it's going to be benign. It's going to cost you out-of-pocket money to get it removed. Then it behooves you to seek out the best physician that gives you the best possible scar.
And we've got a text question from Michelle, very similar. My 13-year-old daughter has a pea-sized cyst on her cheek. What are her options to have it removed? So assuming they know it's benign, then you're looking at the same thing. If you go to a plastic surgeon, you're going to get someone who can do it with the least amount of scarring possible. I guess that's the point.
Correct. And you just want to make sure in kids and developing kids, you want to make sure that you've ruled out some of the very rare types of cancers and sarcomas that can happen in the pediatric age that you don't see in children, in adults. So again, seeing a plastic surgeon with a pediatric aspect to their practice, or do see children, rule out the nasty things that need to be removed to save life and limb, and then the rest is cosmetic, and seek out something that gives you the best cosmetic result.
I'm telling you, if my child had something on their face that just needed to be removed, I would rather spend $1,500 if it meant having a non-visible, non-obvious scar later in life.
And usually that's the case. And during training, we would get called down to the emergency departments in almost every hospital where you rotate, because a mother, rightfully so, will come in with their child. The child's cut, and you're going to see an emergency physician who's excellent at saving lives, but hasn't necessarily trained in saving skin and optimizing scars, and that's why they make plastic surgeons.
416-872-1010. Nima is next. Hi, Nima. Welcome to the Night Side.
Hi, how are you today?
We're good, thank you.
I would like to know, what is the best solution for acne scarring for olive-colored skin?
Acne scarring is a very common complaint to your listeners. Even the last time around, acne scarring was one of the concerns. It affects about 25% of teenage kids, and the heartbreak of adult onset is even worse. You survive your adolescence, only to get into your adult years, and for hormonal reasons suddenly get these scars, and there can be deep rolling hill scars or ice pick scars. In general, you can break it into things we shoot through the skin, like fractional lasers, fractional radiofrequency devices. We can tighten under the skin, and then we can have these very neat new technologies, particularly this product called Interjet, which propels soft tissue fillers and other products right into the skin in the very depth that the scar is. So by multimodal treatment, multimodal therapy, attacking the scar deep, intermediate, and superficial, we can often make between 50 and 85% improvement in the appearance of that scar, depending on the scar type. Now, for olive-complected patients, because you have more melanin in your skin, Hispanic, Asian, Mediterranean patients, you've got to be careful with the energy device device is that we don't remove pigment. And so
Right.
seeking, again, a good dermatologist or plastic surgeon with a lot of technology, you can have a scar-diminished existence.
Great.
Does that help, Nima?
Yes, I just have one last question. If a lot of plastic surgeons say that if you do too much laser, that it could thin out your skin. Is that true, doctor?
It's not exactly true. If you do too much laser, you can cause pigmentation disorders. But in general, all fractional lasers, non-ablative or ablative, that is, create downtime or no downtime, will always create collagen. And you can't create too much collagen. And so use of things like steroids and injectable steroids that some doctors will use when you have an acute acne eruption, like you've got a zit and you inject a steroid, that can thin your skin. You need to be very careful of that.
Okay. So the RF will be better than laser, or would you do both?
Usually it's a combined therapy gives you the best result. I've never seen an acne scar patient with 100% improvement. So set your expectations realistically, shoot for 50, hope for 75, and just find the best, most experienced center in your neighborhood.
Nima, thanks a lot for the call. Sonia is next. Hi, Sonia. Welcome to the Night Side.
Hi, thanks for taking my call.
Sure.
Unfortunately, I've inherited the family under eye bag. And, every morning I kind of give a little tug to see what it would look like to be 10 years younger. And I'm just wondering, what are my options for treatment? I have seen the procedure done on TV where they go in the inside of your lower eyelid and remove the fat pockets, I guess.
Mm-hmm.
And it's pretty easy healing. I'm just wondering, is there other options?
Yeah. How young are you?
I'm 40.
40.
I like that question. How young are you?
I know. Isn't he the best? I know.
That's awesome.
So practically out of diapers. And so this is a hereditary phenomenon. You have this bag that your mom had or grandma had.
Yes.
Is there a blue discoloration to the bag as well?
Slightly. Not really, enough I can conceal it with makeup. More with fatigue.
Okay. And often there's a sunken groove under the bag as well.
Mm-hmm.
So,
yes, there's a bit of a groove there. If I pull the skin, it disappears. It's
exactly.
almost like there's excess skin there.
So you have two options: hold your finger by the side of your eye for the rest of your life, or you simple think of the bag as a hill, and the groove under the bag, and everyone knows, particularly females, what I'm talking about. That's the valley. If you plump up the valley with some Restylane or Juvederm or fat, you can camouflage the hill. And often in your 30s and 40s, that's the simplest, least scary option. Now, as you get a little older and your cheeks deflate and they descend, the bag will become noticeable. And sometimes that's the time to go in from the inside, that creepy thing you see on TV, and we tease the fat pad out from the inside. Use a little laser or a little laser or a skin pinch to tighten the skin. And that can lead to amazing results. But that surgery, about a week of downtime, is going to run you between $2,500 and $4,000. But sometimes, after 15 years of frustration and makeup and powder and looking tired when you're not, and people saying, "Oh, did you get sleep last night?"
Spending a lot of money on creams that don't work.
Yeah,
absolutely. Sometimes just going right for a lower lid bleph is your best way to conquer a frustrating problem.
Thank you.
All right, Sonia, thanks a lot for the call. And we are almost out of time. So here's what I wanted to ask you. We've been talking about all of these amazing procedures, especially non-invasive. And I mentioned this in the break. Will we one day look back and be amazed that we ever actually took a scalpel to people's skin?
Sad to say, I have to agree. I think I am becoming a vestigial professional, meaning that I'm going to be superfluous. We're going to look back on this era as Game of Thrones, and I'm Ned Stark, and we're all going to get beheaded as plastic surgeons, because I think we're headed towards a world of recombinant DNA, of stem cells, of non-invasive treatments. And so right now, the war against aging is waged by scalpel-bearing Gandalf wizards, but that's Middle Earth, and the final episode is coming. But fortunately, that'll be the last day that I retire, so that's good.
But are you excited about this new world of procedures?
I'm very excited. This non-invasive world has allowed so many people to come into aesthetic enhancement for the right reasons. They're never going to do surgery, but if you're faced with an opportunity where you could look 10 years younger to 15 years younger for the rest of your life and never undergo the risk of a surgical intervention and feel just good about looking fresh and youthful and vital, I might say it says a lot about our society where we value appearance so much, but I'm not here to save the world, just to help realize our goals and expectations. So we can live looking 10 years younger, without ever undergoing surgery. And that's an amazing thing.
It is an amazing thing. Dr. Stephen Mulholland, thank you so much for this.
Thank you very much,
We're already
Barb.
out of time. Hopefully we'll see you again soon.
Thanks again.
Cosmetic plastic surgeon at SpaMedica. The website is SpaMedica.com. You're listening to In-Depth Radio, News Talk 1010.
You've been listening to a segment from the Best of the Night Side with Barb DiGiulio podcast. Log on, listen, and download the latest podcast right now by visiting newstalk1010.com.